This video is going to be really educative, rich and as brief as possible. But before then, please like and subscribe to my channel, don't forget to hit the notification bell for more amazing updates. Thanks. Now, what is diabetes? Diabetes is a disease, whereby the body neglects to use the ingested glucose appropriately. This could be because of absence of the hormone insulin or in light of the fact that the insulin that is accessible isn't working adequately. Now, diabetes mellitus. The term diabetes is the abbreviated rendition of the complete name diabetes mellitus. Diabetes mellitus is gotten from the Greek word diabetes importance siphon, to go through. The Latin word mellitus importance sugary or sweet. This is on the grounds that in diabetes abundant sugar is found in blood just as the pee. It was referred to in the 17th century as the pissing evil. Diabetes is the study of disease transmission. Diabetes is the quickest developing long-haul malady that influences a large number of individuals around the world. Let's take United Kingdom as example, where in excess of 2 million individuals in the UK have the condition and up to 750,000 more are unconscious of having the condition. In the United States, 25.8 million individuals or 8.3% of the populace have diabetes. Of these, 7.0 million have undiscovered diabetes. In 2010, about 1.9 million new instances of diabetes were analyzed in populace more than 20 years. It is said that if this pattern proceeds, 1 of every 3 Americans would be diabetic by 2050. Kinds of diabetes. There are 2 kinds of diabetes, type 1 and type 2. Type 1 diabetes is called insulin-subordinate diabetes mellitus and happens at a more youthful age or adolescence. In these patients there is finished absence of the hormone insulin that orders outer organization of the hormone normally as treatment. Around 75% of individuals with diabetes have type 2 diabetes mellitus. This was before named non-insulin subordinate diabetes mellitus (NIDDM) or development beginning diabetes mellitus. The quantity of individuals with type 2 diabetes is quickly expanding. In type 2 diabetes, insufficient insulin is created or the insulin that is made by the body is deficient to address the issues of the body. Stoutness or being overweight inclines to type 2 diabetes. Gestational diabetes. Gestational diabetes happens in pregnant ladies who have never had diabetes, however who have high glucose levels during pregnancy. Gestational diabetes influences about 4% of every single pregnant lady. After labor, the mother may proceed to create type 2 diabetes. How is glucose directed regularly? At the point when food is taken, it is separated to littler segments. Sugars and starches are subsequently separated into glucose for the body to use them as vitality source. The liver is likewise ready to make glucose. In typical people, the hormone insulin, which is made by the beta cells of the pancreas, controls how much glucose is in the blood. When there is overabundance glucose in the blood, insulin invigorates cells to ingest enough glucose from the blood for the vitality that they need. Insulin additionally invigorates the liver to assimilate and store any glucose that is overabundance in blood. Insulin discharge is set off after a feast when there is ascend in blood glucose. At the point when blood glucose levels fall, during exercise for instance, insulin levels fall as well. A subsequent hormone fabricated by the pancreas is called glucagon. It has the contrary capacity of invigorating the liver to deliver glucose when fundamental. Side effects of diabetes. The principal indications of diabetes are 3: polydipsia, polyphagia and polyuria. These mean expanded thirst, expanded craving and expanded recurrence of pee. Likewise, patients whine of feeling tired and weight reduction and loss of muscle mass. Type 1 diabetes can grow rapidly, over weeks or even days, while type 2 diabetes may grow progressively. What occurs in diabetes? Because of need or deficiency of insulin, there is high blood glucose in diabetes. Overabundance glucose in the blood can harm the veins. This prompts a few complexities like coronary illness, kidney harm, nerve harm, eye harm and visual impairment, weakness and stroke. Diabetes, when not controlled, may raise the penchant for diseases. Contaminations and gangrene of the lower appendages is normal in uncontrolled diabetes. This may require a removal if extreme. Individuals with diabetes are likewise 15% bound to have a removal than individuals without the condition. Anticipation, treatment and care. The danger of inconveniences with diabetes can be diminished by holding fast to clinical guidance and monitoring diabetes. Glucose ought to be routinely checked with the goal that any issues can be identified and treated early. Treatment includes both sound eating regimen and exercise, just as oral prescriptions to control glucose. In all kind 1 diabetics and in serious uncontrolled sort 2 diabetics at least 1 infusions of insulin daily might be required. For more information about diabetes and even if cure, check out the link in the description box below. Don't forget to like and subscribe to our channel for more updated. Thanks for watching, stay tuned.